Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
When people start ketamine treatment for depression, they often hear certain words early on. Response, partial response, remission. They sound clinical. They sound important. But they're rarely explained in a way that actually makes sense day to day. Today, we're going to slow that down. We'll talk about what these terms really mean, how clinicians measure progress during ketamine therapy, and why improvement often happens in stages, not all at once. If you're in treatment, considering ketamine, or just trying to understand what progress actually looks like, this episode is for you. In mental health treatment, feelings matter, but patterns matter too. Clinicians use tools like the PHQ-9 or the MADRS to track symptoms over time, not to reduce you to a number, but to create something consistent, something that can show change clearly. These scores help answer questions like, is the treatment working? Is improvement holding? Do we need to adjust the plan? That's where terms like response and remission come in. They give shape to progress that can otherwise feel vague. Let's start with response. In ketamine treatment, a response usually means a 50% or greater reduction in symptoms compared to where you started. That's not a small improvement. That's a meaningful shift. In a large real-world study from the VA health system, about 26% of patients reached this level of response by week 6 of treatment. What's important here is not the percentage, it's the idea. Response means something is clearly working. Symptoms are moving, not just fluctuating. The treatment has enough traction to continue. Reaching a response doesn't mean treatment is finished. It means it's strong enough to build on. Now let's talk about partial response. This is the stage most people actually experience, but it doesn't always get named. Partial response means symptoms are improving, but not yet by 50%. You're not where you started, but you're not where you want to be either. In that same VA study, 26% reached full response. 15% reached remission, which means many people were improving, but somewhere in between. Clinicians usually see this as good news. Partial response tells the care team, the brain is responding. The direction is right. Adjustments may strengthen the effect. This is often when clinicians fine-tune dose, timing, spacing between sessions, or add supportive therapy. Partial response is momentum, not a failure. Remission is the goal most people have in mind, even if they don't use the word. Clinically, remission usually means symptoms fall into the minimal or near-absent range. In the VA study, remission required a PHQ-9 score of 5 or lower. About 15% of patients reached remission by week 6. That might sound low, but remission often takes time. When remission happens, the treatment strategy changes. Instead of reducing symptoms further, the focus becomes preserving stability, preventing relapse, spacing sessions responsibly, supporting long-term functioning. Remission isn't about pushing harder. It's about holding steady. One good day doesn't tell the whole story. That's why clinicians track symptoms repeatedly across a ketamine treatment series. Most patients start with a baseline score. Repeat it at regular intervals. Compare trends over weeks, not days. In the VA data, improvements seen at 6 weeks were largely maintained at 12 and 26 weeks. That consistency matters. Clinicians also look beyond numbers. Is daily life easier? Are relationships improving? Is functioning coming back? Scores tell part of the story. Life tells the rest. Improvement rarely happens in a straight line. Most people don't move directly from symptoms to remission. They move through stages. Partial response, then response, and sometimes remission later. Even partial improvement can create real relief. More energy, less emotional weight, better engagement with life. That relief often makes deeper healing possible. Response, partial response, and remission give language to change. They help clinicians guide treatment, and they help patients understand what's happening and what's next. If you're in ketamine treatment and wondering where you stand, or if you're considering it and want a clear picture of what progress really looks like, you don't have to interpret this alone. At Zeam, we use these benchmarks to personalize care, track change thoughtfully, and support long-term stability. If you'd like to talk through your progress or explore whether ketamine treatment is right for you, reach out to our team in Sacramento, Folsom, or Roseville. We're here to help you move forward step by step.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.